Hello, everyone. We are Healing Hearts, Healing Paws. And even though I see us both on a screen on one shot, I think when it records, it's not going to do that. It's going to go from person to person, which is very annoying. But anyway, I heard that that's what it does now. I don't know. I've heard someone else say that. So we are talking about environmental allergies. I am your host, Rebecca Roseberry. I am a medical intuitive, a nutritionist, and healer, and have been for quite some time now. And my co-host, I will pass on. You can speak for yourself.
I am Dr. Kristen Colleran, and I am an integrative veterinarian. So my specialty is acupuncture, chiropractic, herbal therapies.
That's a mouthful. And I was thinking about when we were about to do this a few minutes ago, I'm thinking, how cool is it, your background, and having a holistic vet that has your background, I think is very special, especially in this area. We're in like the Southport, Oak Island, North Carolina area. And I think that's very unique and very special.
Thank you. It is actually. There are no other practitioners in our local area. People would have to go to Wilmington or to Charleston.
See?
Yeah. Yeah.
You're a little unicorn like me.
Thank
We're all
you. Yes, I like being a unicorn.
We're very, very unique, both of us. So ironically, here we are putting this program together. So I thought, if you want to start and share with our audience about your experience with environmental allergies and what people need to know, and then I'll go after you. And yeah,
You'll do the human side of it.
I'll do the human side of it. That's right.
Yeah. So it's an interesting topic. I think most people think about it in the springtime, and certainly that is the time of year where we see a preponderance of environmental allergy responses. But definitely this time of year, with the shift from summer to autumn, we're getting a resurgence of different types of pollen, and I'm seeing a lot of pets coming in very itchy with skin and ear conditions, which would be related to allergies. So most of the time, humans, I think, show their environmental allergy symptoms as respiratory, whereas our pets tend to show them more as skin and ear issues. Sometimes we'll see watery eyes and they might sneeze, but in general, it's mostly skin and ear issues. When you go to a regular vet for these problems, they're going to prescribe probably steroids or something like Apoquil or Cytopoint, other immune modulating agents, and possibly antibiotics or a topical shampoo if there's a secondary infection present, or ear medications. So most people who have pets with allergies are pretty familiar with these things. And I think that most people who have pets with allergies also are frustrated because it's this never ending cycle. You just get the ear infection cleared up and a couple weeks later it comes back again, or the skin clears up and then it comes back again, or the itching resolves with the medication. And as soon as they come off the medication, then we get some scratching going on again. So the goal for me as a more holistic practitioner is to look at the underlying root cause rather than treating the symptoms. So the symptoms that we're seeing are the scratching, are the bacterial infections of either the skin or the ears, the yeast infections. So in regular veterinary medicine, I think sometimes we call it traditional as well. I don't know why, because it's really not traditional. I mean, the medicine that we practice now is actually very new compared to, say, acupuncture, which is thousands of years old, for example. Or even homeopathy is like 300 years old. But for me, I want to look at the underlying issue. What is actually out of balance with the body that is leading the body to abnormally respond to allergens or proteins in the environment that it really shouldn't have an exaggerated response to, because that's what an allergy is, in effect. It is an exaggerated response of the immune system to things in the environment that it should not view as pathogenic.
Yeah.
I also do want to add, mentioning pathogens, when we see these bacteria and yeast infections, those are actually bacteria and yeast that are normally present on the skin. So just as we have a microbiome in the stomach or in the gastrointestinal tract, which I'm going to talk about briefly as well, we do have a microbiome on our skin. And what happens is when the immune system is triggered by these environmental allergens, it responds by traveling to the skin and we get inflammation. And then that upsets the local environment of the skin and we get overgrowth of bacteria and yeast that are present. So when your vet is using antibiotics orally, that's going to be a huge issue. But also if they do topical shampoos, then that's just reducing the numbers of bacteria and yeast that are present on the skin. And it does not differentiate between any pathogenic or normal bacteria. Just like when you take antibiotics, it doesn't differentiate between pathogenic or good bacteria in your gut. You just get a total wipeout of the bacteria and yeast or the microbiome. So I would kind of view it as the intestinal tract and skin being one organ. So like from mouth, lips, skin, all the way back to like booty and then to the intestinal tract. And if we are completely depleting our normal microbiome for skin and gut, then we're creating an unhealthy skin barrier. So we're creating a situation where the skin is not going to be able to respond as well in the future to pathogens. So we're just perpetuating that cycle. So the first thing there are two things that I normally will do for pets with allergies. One is look at the diet. If a pet is on a kibble or a canned food, those are ultra processed foods. So I want you to imagine eating McDonald's every day or eating hot dogs every day. Same meal every day. That is very unhealthy. And we know from research that ultra processed foods are pro-inflammatory. So if we have a patient that is leaning towards allergies or an allergic response, but they have a sick immune system in effect, then feeding them an inflammatory diet is just feeding that inflammation. So I talk to people about home cooking, about doing pre-made raw foods or dehydrated foods, minimally processed foods that are low in inflammation. That can make a world of difference on its own. But secondary to that, I know that if they're experiencing allergic responses, then their microbiome is out of whack. 70 to 80% of the immune system is in the GIT and the gastrointestinal microbiome. If that's out of balance, then their skin's going to be out of balance and their immune system is out of balance. So there's a company that I use, and I'll do microbiome testing with them. And what's been fascinating is to see the level of, let me backtrack a little bit. To have a healthy immune environment in the gut, you need a variety of microbes and you need good levels of these positive microbes. And many of these microbials are involved in anti-inflammatory effects in the body, as well as digestion of protein and fats and carbs. And they can reduce pathogens in the gut, etc. So if a pet, what I'll find is that pets that have been on kibble or processed food for a good while, if not their entire life, even for like a year, 2 years, their microbiome is totally disrupted. So I will see that there is very little variety. They're missing so many of those microbes that are involved in anti-inflammatory responses and digestive processes. So why are digestive processes important with allergies? Because we create our immune system through proteins, right? Through protein digestion. So if we don't have the bugs to help reduce inflammation in the body, we don't have the bugs to help us digest protein, we're not able to replenish our immune system either. So those are the two main things that I'll do is test the microbiome. And then by knowing how out of balance it is, I'll know how to replenish it and in what way to replenish it, whether it's because there's bacterial overgrowth of bad bacteria or we don't have enough good bacteria, whatever. So we do that and diet. And really, many times doing those two things can resolve those environmental allergens. It takes a couple months for the shift to happen, but it can work. What I'll do in the meantime is acupuncture and herbal therapy. Sometimes some supplements like from Standard Process or other companies, like Dora Beast has some products that I'll use as well, or RX vitamins, just to name a few, 4-leaf rover. But we'll use these acupuncture and herbs can help bring the body back into energetic balance and can help control the symptoms. Some of the supplements really are just to ameliorate the symptoms until we get the shift over with the immune system and the diet and everything. So it just depends on the severity of the symptoms. So that's usually what I recommend, because allergies are not just a simple, oh, he's scratching right now, or she's scratching right now, or she got an ear infection, and that's the end of it. It really is a symptom of a deeper imbalance that's going on, and you need to direct your attention to that imbalance in order to maintain or actually restore your pet to health. Does that make sense?
It totally makes sense.
Yeah. Yeah.
100%.
So I can say, hey, you can use like Ansha next to a standard process, or you can order, such and such a product from Pet Wellbeing or from Adore Beast. But until you get those two like pillars of health
Yeah.
stable, then you're just going to be stuck in this rotation of going back and forth and repeating the cycle of these symptoms of allergies. I kind of view allergies not so much of an annoyance, but as a red flag that my patient's health is out of balance, and there's something that we need to look at to bring them back into balance.
Agreed, agreed, agreed. Well, thank you, thank you, thank you.
Yeah, people are probably a little bit easier. Maybe. There's actually psychological, I think,
I
involved.
don't think so. I think people are the problem. Right?
Yeah.
So, all right. So I'm going to come from a slightly, different point of view, but we're saying the same thing, of course, because now I'm going to just look from, okay, so when working with human beings, so what do I have in my notes? Yes, that this is a symptom of an imbalance within. It's actually a reflection of, I like the analogy of the microcosm, macrocosm, right?
Mhm.
So we're talking about environmental allergies, the environment that's quote unquote out there, but it's a reflection of what's going on inside. So
Mhm.
if you look at the inside, when you heal the inside, it will help the reaction to the outside. So we're saying the same thing, but okay. So what I look for, well, because I do energy medicine, I look very talk about unicorn, look for portals into what's going on, but that's for another topic, meaning I'll look for weaknesses in their aura and then start backtracking. But for the sake of this podcast, I will look at someone's stomach pH, saliva pH, and intestinal pH via muscle testing, and then recommend certain supplements. Particularly, and I made a list of ones that I would use, and they're 99% from standard process, but I might offer someone with parotid PMG to help with the mouth. But then going down into the stomach, what I find interesting is that when I hear people say, oh yeah, I just take a Zyrtec or a Claritin, and I'm like, la, 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 la. I would recommend Zypan, and Zypan is actually going to help the stomach's pH from a holistic, more holistically than taking Zyrtec. When I looked at the ingredients in Zyrtec, and I'm like, wait a minute, this is just a system acidifier. That's what Zypan is. I may recommend something like Zymex for to change the pH in the small intestines, or lactins or prosymbiotic, as in acidophilus. I don't know, my mind just went somewhere else. And then what I love to use a lot, which is not from standard process, and I may be pronouncing it wrong, I hear people pronouncing it differently, is quercetin. Some people say quercetin, but that one works really well. So I use that in conjunction with a vitamin C, like Echinacea C, perhaps. And then from a symptom standpoint, things like Allerplex, or Sinus Forte, and I could go on and on. But what I want to talk about more interestingly is the psyche at this time. So think about it. This what we're talking about, we're doing this recording and it's September. It's like perfect timing for season change, right? And when we have a season change, I swear, their physiology gets stressed because of change, if they have issues with change. So these are just things that I will start a conversation about and bring awareness to, and then we'll recommend the emotional freedom technique to work on these, the psychological piece. I also see when I scan their aura, things like airborne candida. That might sound strange, but it's, for whatever reason, it shows up as airborne. And then some other things from total body modification terminology that I will almost always see are things like autoimmune switch or suppressed. And that just lets me know that the immune system is compromised, and it's just like a door to ask more questions. But as a whole, emotionally, someone is in a place of fear, and it's usually subconscious fear, of course, the fear of change, perhaps. And then to me, when I see allergies in the springtime, it's slightly different. It's something about their self-esteem. And what's interesting, it's a form of self-pity. That's been my conclusion. It's like, woe is me, woe is me. And it's like a socially acceptable way to connect to what you're sad about, that you haven't allowed yourself to cry about. So those are all the doors that I may go through. But if, in September, it's more of the fear of change. In springtime, it's more of like a sympathy for this, it's like, or self-pity. So I find that interesting. And that's where the emotional freedom technique comes in and things like that. But let me see what else I had that I wanted to share. It does seem to be a reflection of too much yeast, as you said, and getting the pH in balance. But lastly, the small intestines are the area where I think it's not a coincidence that the small intestines, you're talking about self-esteem, and you're talking about the intestinal flora. I think though that's the crux of it. But I'll just end with that. But I hope when you see, for those listening, think about all of the factors that we just shared and how comprehensive and complex this subject matter is. And you're going to pop a Claritin. You fool.
Yeah,
Like
it's
once,
addressing the symptom. That's it.
yeah,
It's not looking at, hey, what changes do I need to make and actually to heal this? This is a
yeah.
sign that something's not, working right.
Right. Once you have the knowledge, you can't go back. You can't go back. Once you know the bigger picture, you can't go back. That would be, oh my God, that's like blasphemous. To know, like, you have to know what you're doing. Once you know what you're doing or what's actually happening, how could you treat your body any other way or your situation any other way? But anyway, that's just me preaching. So, do we have anything else we want to add in closing?
I think one thing I would add is two things actually. One is the microbiome in dogs and cats is not the same as a microbiome in humans. So a lot of people mistakenly think that they can just supplement with probiotics, which in general for pets are lactobacillus and bifidum species, which are really seen more so in humans,
Yeah.
and some of the enterococcus and that kind of thing. But when I do my testing, you can see there are an array of bacteria that are not included in your general probiotics. So if you're giving a probiotic every day, say Lactobacillus bifidum, you're promoting that bacterial population at the detriment of the other bacterial populations. So you cannot substitute probiotic supplementation with microbiome testing. That's one. Two, I would say that allergies are being a sign of the immune system. It is the first sign that we will get. I think that it's like a mild illness of the immune system. The ultimate illness of the immune system is cancer. So
Yeah.
for me, it's a stepwise process. So you get allergies, then you get autoimmune disease, and then you get cancer.
Yeah.
So by addressing, so allergies are kind of like the first flag up in your patient that's saying, hey, this immune system is sick. We need to get it back into balance now and create a healthier environment for this body before we move into autoimmune and
Right.
then cancer. And I think when you're talking about the emotional element of it, like the allergies are self-esteem or self-value, and then autoimmune is self-hatred. So it's moving from
Right.
that you know, stage of, oh, I'm so sorry for myself, or this is going on, and you know, this kind of victim, or things aren't going well, into things aren't going well because I am not a good person. That's the value, or I am not worthy. And that goes into I am not worthy. I hate myself. So you get this natural progression. And then cancer is the ultimate attack on the body. So I think, you know, I don't think I see I, animals do show emotions and have emotions, but I'm not sure they get into, I think that they will follow through emotions through that pattern a little bit differently than humans.
Yeah.
Um, but I think more with them, it's a grief issue or abandonment and that kind of thing.
Um,
But I think it's important to note that if you're having allergies, popping a Claritin or giving your pet an allergen is not like you are just masking a deeper issue. And when you are seeing that, like understand that this is like your body sending out like a red flag to say, hey, we need to take care of some stuff here in order to maintain our health.
yeah. Well said. Thank you.
Yeah.
So listen, everyone out there.
No more Claritin or
No more.
Benadryl.
Right. No, right. Or Benadryl. And no more Zyrtec, and heal your body and heal your heart.
Yes.
Goodness sake. All right, so we are available for sessions, and that's part of the reason why we're doing this, to bring awareness and to get people to start thinking holistically,
Mhm.
or to empower people with this information. And so it becomes mainstream again. Like
Yeah.
you said, right? This has been around for thousands of years. Why do we have
Right.
to relearn this? I have no idea. But anyway, that's for another
Yes, totally. Because then you get into drug companies and that kind of thing.
time.
Yeah. Yeah. Yeah.
So thank you all for watching, and stay
Mhm.
tuned. This was episode 7, and we don't know what we're doing from here, but I hope you enjoy this podcast and hope you enjoyed the other ones that we've done. And we'll see what the future holds.
Sounds good. All right. Thank you.
Thank you.